A doctor we know lost a patient she shouldn't have lost. She was an OBGYN. She was a postpartum patient that she had was high risk. Her blood pressure had been creeping up between visits. She didn't know that the fifth day postpartum was the day that was the riskiest. Not because she didn't care, the doctor didn't tell her to care, because there was no way to see it, there was no way for the patient to report it. She died of a stroke with a newborn and a 2-year-old at home. The doctor was connected to our team, and that loss is part of why Connect exists. Not just to help patients capture revenue, but because when patients have a real-time way to communicate between visits and doctors have a real way to see it, their outcomes change. That's what this is about. Whether you're a chiropractor with a chronic patient that needs to report their progress or pain, or a doctor with a post-surgery patient or long-term rehabs, substance abuse, or mental health groups that want to stay engaged with their patients and their progress and their recovery, or you just want to provide patients with the better care in your office with the better process to notify you when they need help or things are going on with their care, we built Active SOS and Connect applications to help do that. We already had Active SOS app on the app stores. It was the most customizable communication tool on the market. It was the best way we had to do this, protect patients' privacy, and give them a way to communicate if they needed help and to stay engaged with their family and friends or their coworkers. What we didn't know was we were going to run across doctors that said, hey, that can help my patients. That can help me stay engaged. That's when Connect got built. Here's the reality most patients and practices aren't living up to right now in the way that we handle patient care. You're monitoring chronic care patients, high-risk patients. You're logging calls, you're following up on their vitals. You're doing the work of the RPM and RTM processes, remote patient monitoring and remote therapeutic monitoring, but you're not tracking it the way that could be done to help you do that better and to monetize it. You're tracking it by hand with spreadsheets, sticky notes, someone trying to remember who hit the 20-minute billing mark threshold to see if I can charge for that and bill for that. That's not efficient, it's not effective, it's not compliant, and it's an audit risk. It's also lost revenue every single month. We're not trying to add any other systems to your already full plate and all the things you have to do now to track your patients. We're here to replace that manual process you already have, integrate that with the systems you have, and to help you do that better. A system that documents itself and flag what needs attention without adding overhead to your staff. That's the Connect portal, one dashboard built specifically for RPM and RTM and the workflows around it. Every message your patient sends, blood pressure, weight, daily check-in, medication confirmation, pain levels, land here immediately. The system automatically tracks the time associated with each interaction, no extra charting, no manual logging of every message received. Your staff sees what's routine in the portal, they see what needs attention, and they can triage the entire process and message queue supported by reviewing the entire population at a glance using AI engines built into the data. Without anyone sitting there next to a text message or a phone portal, just seeing if there's another text message came in asking for someone to renew their prescription. That's not what we're doing here. Let me show you this live. This is Active SOS in the app. What your patient sees on their phone. They already have a phone. They don't need another device from us. The most customizable, privacy-focused patient communication tool of its kind. They open it, they select their practice, number that you've chosen to give them to send information to. They choose what alert they want to send. They can customize that alert. They send a safe message or an SOS message, and they send it. One tap. Now look at the portal. There it is, the message received instantly. And here's what no other platform in a space can do. They show their exact GPS location. What if you do have a patient that needs help? What if you do need to know where they're at when this message got sent? Not just a zip code, not just a general building, an exact 17-digit GPS to exactly where they are. But again, we're in a privacy environment. We keep this closed within Active SOS. We don't sell it. We don't monetize that part of it. We just want to make sure you have that information. Every patient has a complete profile in here. Their diagnosis codes, what their care classifications are, what type of billing they have. And we monitor not only the billing that can be done from it, but also the amount we expect to get for that billing, depending on the kind of patient that is. Medicare, workers' comp, private insurance, whatever that is, we can see what that would be. When your team interacts with the patient, a 5-minute call or a medication review, a care coordination note, you log it right there. You log it in the system, and that counts toward the minutes that you need to have to document, to monitor that patient every month. Automatically, without having to add it up at the end of the month, it does that automatically. This is the overhead reduction right there. Your staff documents once, the system does all the rest. Now here's what that's worth. This practice has 52 patients in it. In 1 month, you got about $600 to $800 ready to bill. We tell you what's automatic. We tell you what's in place already, and we make that as efficient for you as we possibly can. Every patient's matched to the CPT codes and ICD codes that they're related to. We want to make sure that their diagnosis matches the RPM and RTM codes that we're using. Practices with the 100 qualifying patients would usually say about $100,000 or more in revenue. We're being conservative. We have to be in this marketplace. Revenue you're already doing the work for to earn, you're just not collecting it. No extra visits, no new services, just a better process around what you're already doing. Last thing, the one thing that matters for patient care as much as billing. Connect includes an AI-powered triage summary. We actually called this RPM triage to start the process when we first rolled it out. It flags patients who need attention before your staff even has to look. And for each individual patient, it generates a plain language summary. Doctors didn't want to get a report, all the data we sent them when we first sent this out, and said, I don't want to see 100 messages for that patient for the last 2 or 3 months. Tell me what that means. We took a little AI engine, embedded it in the back end, and said, let's read all that data and tell me a summary for that patient in a 1 or 2 paragraph answer. Improves patient care, improves your compliance, and improves your ability to spend the time helping the patient, not trying to read a report. Okay. The data is there, the system does the work, and your team acts on what matters. We built Connect because the gap between the doctor's care and the tools that they have is too wide, and it's too costly. If your practice is already doing this work and not getting paid for it, let's fix that. Contact us through david.zink@activesos.com, or you can reach us and book a call at activesos.com/call to book a meeting with us. Let's walk you through it in more detail, give you a better demo of this, and let's talk about how we can implement this in your practice.